In this video, I will present the pharmacological actions, clinical indications, and adverse effects of statins. Statins are one of the medications used to lower blood cholesterol levels. They all have statins in their name suffix, such as atorvastatin, rosuvastatin, lovastatin. We can measure the amount of certain fat molecules, also called lipids, in the blood by lipid panel. It usually gives results for 4 different types: total cholesterol, triglycerides, the most common type of fat in our body, low-density lipoprotein or LDL, the bad cholesterol, and high-density lipoprotein or HDL, which is the good cholesterol. Total cholesterol is the overall cholesterol level. It includes both triglycerides and LDL, HDL cholesterols. Total cholesterol should be lower than 200 mg per deciliter. Triglycerides should be lower than 150 mg per deciliter, and LDL cholesterol should be lower than 100 mg per deciliter. HDL cholesterol is considered good for health, and it should be above 40 mg per deciliter in men and 50 mg per deciliter in women. In our body, cholesterols are made mainly occurs in the liver. Cholesterol and triglycerides are packed in the liver cells, and enter the bloodstream, in the form of VLDL, or very low-density lipoprotein. As VLDL delivers cholesterol and triglycerides to peripheral tissues, VLDL is transformed into increasingly cholesterol-rich LDL. When LDL cholesterol are too high in the bloodstream for a long time, they stick on the wall of arteries and become atherosclerotic plaques. Over time, the plaques grow bigger and the blood vessels become narrow. For example, when coronary artery becomes narrow, blood flow to the heart is very limited, and heart attack can occur. Similarly, stroke develops when the blood flow to the brain is not adequate. On the other hand, HDL cholesterol cleans up cholesterol in the blood, and carries back to the liver, known as the reverse cholesterol transport. High level of HDL cholesterol can lower the risk for heart attack and stroke. The key action of statins is to decrease LDL cholesterol. Let's go into detail about the mechanism of action. Cholesterol synthesis is a complex process that occurs in hepatocytes. Different enzymes involved in this process. The most important step of cholesterol synthesis is the conversion of HMG-CoA into a compound called mevalonate. HMG-CoA is the short form of 3-hydroxy-3-methylglutaryl coenzyme A. The enzyme that catalyzes this step is called HMG-CoA reductase. This is also the rate-limiting step of the whole reaction. If the enzymatic activity of HMG-CoA reductase is inhibited, cholesterol production is decreased. This is the step where statins work. They inhibit HMG-CoA reductase enzyme, and stop the production of mevalonate, and lower the production of cholesterol in the liver. The less cholesterol are synthesized, the less VLDL are produced. The less VLDL enters the bloodstream, the lower the LDL cholesterol level. When cholesterol synthesis is blocked, the liver cells contain less cholesterol. As a response, liver cells upregulate the LDL receptor synthesis, and more LDL receptors are expressed on the cell surface. LDL receptors picks up LDL cholesterol from the bloodstream, and transport them into the cell. LDL cholesterol level decreases further, as more LDL cholesterol leaves the bloodstream. Therefore, statins are very effective in decreasing LDL cholesterol level. They can also decrease VLDL and triglyceride levels to some extent, and increase HDL. Cholesterol is made in the liver, typically at night. Some statins are preferably taken at bedtime. Lovastatin is the first statin approved for the commercial use. Lovastatin and simvastatin are prodrugs. They are not active form, metabolized in the liver to their active forms. Pravastatin is administered orally in the active form. These three statins are taken at night as cholesterol synthesis mainly occur at night, and also that they have short half-lives, less than 6 hours. Atorvastatin and rosuvastatin have longer half-lives, up to 19 hours. They can be taken any time, as long as the time of doses is consistent. One thing to note is that atorvastatin is the lipophilic statin. It can easily pass through cell membranes and enter muscles and tissues faster. This may be related to some adverse effects. This will be discussed later. Rosuvastatin is most hydrophilic and do not easily get into the muscle cells. Rosuvastatin is the most potent statin. 5 mg of rosuvastatin equals 10 mg of atorvastatin, 20 mg of simvastatin, 40 mg of lovastatin, and 40 mg of pravastatin. Atorvastatin and rosuvastatin can lower LDL cholesterol level aggressively, and they are considered high-intensity statins. Higher doses of atorvastatin and rosuvastatin are used as high-intensity statins. High-intensity statins do have some risks and side effects. Statins are the recommended first-line treatment for high cholesterol in most patients. They can be combined with other cholesterol-lowering drugs, such as ezetimibe or PCSK9 inhibitors, to lower cholesterol level furthermore. Statins are primarily used for prevention of ASCVD, atherosclerotic cardiovascular disease. ASCVD includes acute coronary syndrome, myocardial infarction, stroke, and peripheral arterial disease. Statins are used for primary prevention of ASCVD, to prevent or delay the onset of ASCVD in patients who do not have such diseases. Or for secondary prevention, to prevent or delay the onset of disease manifestations in patients who have clinically significant ASCVD. Statins are prescribed to 4 patient groups. In first group, the patients had clinical ASCVD, meaning they have had heart attack or stroke or any other ASCVD. This group of patients receive a high-intensity statin for secondary prevention. In second group, patients have high cholesterol, LDL cholesterol more than 190 mg per deciliter. They are automatically given a high-intensity statin. In the third group, patients have diabetes mellitus. Once the patient has diabetes, ASCVD risk should be estimated by using a calculator. This risk estimate considers age, sex, race, cholesterol levels, blood pressure, medication use, diabetes, and smoking status. This will provide how likely the patient will have ASCVD event in next 10 years. If the score is more than 7.5%, they receive a high-intensity statin, and less than 7.5% receive a moderate-intensity statin. The last group is non-diabetic patients, who have LDL cholesterol between 70 and 189 mg per deciliter. Their ASCVD score is calculated, and if the score is more than 7.5%, they receive moderate to high-intensity statin. This is based on clinical judgment. Statins are very good in prevention of ASCVD, but they are not without downside. Generally, statins are tolerable. Many patients who take statins experience no or very few side effects. Others experience some side effects, but these are usually minor, such as gastrointestinal upset, headache or dizziness. One of the main side effects of statins is myopathy, which is muscle pain. Lipophilic statins have a higher chance of causing myopathy. Remember, atorvastatin is a lipophilic statin. In rare circumstances, myopathy can progress into much more severe rhabdomyolysis. This is very rare, but also life-threatening. In rhabdomyolysis, muscle damage is so severe that produces myoglobin, that are excreted in the urine. Myoglobin causes urine to turn brownish Coca-Cola-like color. We can do some lab tests, CPK level, which measures creatine phosphokinase. CPK is released during muscle damage. If CPK level is higher than 10 times the normal limit, the patient might have rhabdomyolysis and statin should be stopped immediately. So, mild symptoms and a little bit of muscle pain are expected, and it is okay to continue statin. However, if the patient has severe muscle pain with brownish color urine, rhabdomyolysis should be suspected, and discontinue statin. Another important side effect is liver damage or hepatotoxicity. Statins work in the liver, but they can also damage liver cells. We can do LFT tests and observe liver enzymes. If LFT test shows liver enzymes more than 3 times upper normal limit, statin should be stopped. It is very important to note that all statins are teratogenic and pregnancy category X contraindicated during pregnancy. I hope you enjoy this video. Thank you for watching this video. Stay safe and healthy.